Hi, my name is Lacey, and this is my skill presentation for applying telemetry. So what is telemetry? Telemetry monitoring allows healthcare providers to monitor a patient's heart rate and rhythm while away from the bedside. A non-invasive battery-operated box is placed on the patient, and the box sends information to a visual display where certified teletechs, nurses, and physicians may view the patient's real-time heart rate and rhythm. Who needs telemetry? Well, typically anybody who has a telemetry order, but it's our responsibility as nurses to continue to evaluate the need for telemetry in our patients. The American College of Cardiology Emergency Cardiac Care Committee in 1991 put out guidelines for patients who need telemetry. So Class 1 cardiac monitoring is indicated in most, if not all, patients in this group. Patients in this group include those who suffered from an acute MI, postoperative cardiac surgery. They've been resuscitated from a recent cardiac arrest, critically ill ICU patients, acute myocarditis, unstable angina, and patients receiving certain antiarrhythmic drugs. Class 2 cardiac monitoring may be of benefit in some patients but is not considered essential for all patients. These patients include those who have recently experienced life-threatening arrhythmia and has now been stabilized, clinically significant arrhythmia that is non-life-threatening, unexplained syncope, and acute pericarditis. Class 3 cardiac monitoring is not indicated because a patient's risk of serious event is so low that monitoring has no therapeutic benefit. Patients in this group include stable post-op patients, obstetric patients, chronic stable AFib, and patients suffering from terminal illness who are not candidates for treatment of arrhythmias. So in these patients, I would contact the physician and see if we couldn't remove the telemetry monitor. It's important that you never remove a telemetry monitor without an order from the physician. Prior to applying telemetry, when a patient arrives on the floor and telemetry has been ordered, it's important that you apply telemetry as soon as possible. If the physician orders telemetry for a patient already on the floor, make sure the room is capable for telemetry and apply telemetry as soon as possible. My facility standard is within 5 minutes of getting the order, we must have the patient on telemetry. Always verify your orders along with the patient name and room number prior to applying telemetry. Many healthcare facilities have telemetry technicians that provide surveillance of patients' heart rate and rhythms. These technicians typically operate in a room separate from the unit you work on, and you must call them in order to get a telemetry box. Special considerations. Always ask the patient if they have a history of cardiac arrhythmias. For example, if you had a patient that had chronic stable AFib, you wouldn't want that alarm going off all the time, and you'd want to contact the teletext to let them know to turn off the alarm. This also would contribute to alarm fatigue if you had that alarm constantly going off. Always assess the patient's chest prior to applying telemetry. You do not want to place telemetry electrodes on a pacemaker, incision sites, wounds, ports or central lines, or areas of excessive hair. With patients with excessive hair, I see it as a pain factor. It's really painful even if you can get a rhythm, you really shouldn't place an electrode on a patient with excessive hair because every single time they move, they're going to feel that pain. The electrode's going to pull at that hair. So even if you're getting rhythm, go ahead and ask the patient if you can just use an electric shaver to trim the hair so that you can get better adhesion to the skin. So educate the patient on the purpose and need for telemetry monitoring. I find that a lot of patients become nervous or scared when I tell them that I'm going to put a heart monitor on them, so it's really important to ease their fear. Educate patients that they should not remove the monitor or electrodes without contacting you. Leave the unit without contacting you as the monitor will stop working. Get the monitor wet. If the patient wants to shower, make sure that they know to let you know that they want to take a shower so that you can remove the box and electrodes. A lot of times you need to use your nursing judgment in whether the patient should be able to get into the shower or have the electrodes removed. If they've experienced recent arrhythmia, you really should use your nursing judgment on that. Sometimes it's not appropriate to remove telemetry even for a short while. Our max time on showers usually is about 30 minutes that they can be off telemetry. After that, a teletechnician will usually call us and let us know that we need to put the patient back on telemetry. So the equipment that you'll need is a telemetry box with leads, electrodes, alcohol skin prep, and telemetry box battery. Wash hands, apply gloves, and confirm the identity of the patient. Then prepare the patient's skin. Always make sure the patient's skin is clean and dry, and you can use an alcohol skin prep pad to clean any excess sweat, oil, or lotions off the patient's skin. I find baby powder is an exceptional problem when you're trying to apply electrodes. It really keeps the electrodes from sticking, so make sure that you use that alcohol skin prep pad to really clean the patient's skin. The skin prep pad can also create a little bit of friction where it will remove just a little bit of that top layer of skin and you'll get a better adherence to the skin. The telebox utilized at my hospital is technically a 5-lead system, but it has the addition of the V6 lead. So it's really 6 leads that we put on our patients and 6 electrodes that we place on our patients. These include white, black, brown, brown again, green, and red. There's no particular order in which to apply the leads, but I found it's easiest to attach the electrodes to the leads first, then apply the electrodes to the patient's chest with the leads already attached. This just keeps the leads from getting tangled with one another, and it's also a quicker way to apply the telemetry. So here's an example, and this is actually the box that we use at our hospital right now. And you'll see there's actually a diagram on there that tells you exactly how to place the leads, but I find that a lot of people do not pay attention to that picture. So that's really helpful if you forget, how to place the leads or you don't remember your acronym. You can always look at that picture and apply the leads. Here's an example of an electrode we also use. It's important because there's a lot of different kinds of electrodes. I think we have at least 3 at my hospital. So you always want to apply all the same kind of electrodes. You never want to mix and match the electrodes because it can interfere with the signal and strength of the rhythm that you're getting up on the monitor. So that's always really important. Just make sure not to mix and match these electrodes. Electrode placement. So here you'll see in that image it only has 5 spots where you would apply the electrodes, and that's kind of a typical 5-lead system. But we do at my hospital have the addition of the V6 lead. It's also called a VB lead. So that would be placed in the left mid-axillary line. So here again you'll see RA is with white, LA is black, the VA or V1 is brown, RL is green, and LL is red. Always remember the snow over grass or smoke over fire. I've heard a lot of variations of this, but this is the one that helps me remember best. Also, if that white or green electrode isn't connected well, you're not going to get any rhythm whatsoever. So make sure those are especially placed well. Also, if you lose the connection to the red lead, for example, or the black lead or a brown lead, you may get a rhythm, but it's not going to be accurate. So make sure that you have all of the electrodes attached. Remove the backing from the electrode and ensure that the gel is moist. If not, dispose and get a new electrode. I was not aware of this before I started this presentation, so I'll definitely start looking at the electrodes more carefully. Now that I read the Lippincott procedures, I think this is a really good point. Also, another good point is apply the electrode by pressing your fingers in a circular motion. Don't apply pressure to the center where the gel is, because by doing that, you're spreading the gel out and it will prevent adhesion to the skin. Always double check the leads for a strong connection. After applying the leads, make sure the battery is installed correctly in the telemetry box. Our facility requires us always to contact our tele department to verify the patient's name and room number, as well as the telemetry box identification number immediately after applying telemetry. This prevents the wrong box being applied to the wrong patient. The teletechs are also required to give you a current rate and rhythm, which can be really helpful. Common mistakes and complications. So just make sure that all staff is aware to how to apply the telemetry. I find that when you have different people teaching different people, different preceptors, everybody kind of gets confused on how we're actually supposed to apply it. So make sure that this is a standard of care. It's not just a nurse skill. Patient care techs and nursing assistants also play a very active and helpful role in making sure that the telemonitors are functioning and applied properly. But remember that it's your primary responsibility as the nurse to keep the monitor applied and functional. While it's important to delegate, you need to make sure and follow up that these tasks have been completed correctly. Again, use your nursing judgment. Sometimes it's not always appropriate to remove a patient from telemetry due to recent cardiac arrhythmias or other acute processes. If the patient wishes to bathe, try using bath wipes, and you can kind of avoid the chest area, and that's a better temporary solution. Many times if the patient is actively sweating or moving, the electrodes will lose their adherence to the skin. This can be a very frustrating problem for the tech, nurse, and patient especially, because we're constantly going into their rooms and bothering them, and it's really good to just try to solve the problem at the root cause of the problem instead of just correcting it over and over again. You can try to provide comfort in the room and adjust the temperature as needed to keep the patient from sweating. Sometimes teletechs can also send you special electrodes that are specifically like very, very good, very adhesive, but typically these are more expensive electrodes, so they don't like to give them out freely. But if you do that, just make sure again to use all the same kind of electrodes and you're not mixing up different electrodes. For a patient that ambulates frequently, it's important to give them a purse, we call it a purse, but a satchel or a pouch, I've heard it referred to as, to put their box in while they're ambulating. Keep in mind, if the leads are not appropriately applied, there will be no signal to monitor. This can be displayed as lead fail or asystole. You may see this on the monitor available to you at the nurse's station, or a teletech may call you. You always want to make it a priority to immediately assess this patient that's having this problem, because sometimes if you see a systole on the screen, you'll run into the room and the patient's just simply removed the telebox. But this could go both ways, so it'd be important, even if you saw lead fail, to immediately assess your patient, because that could be, if it's happening for a systole like that, it could be happening with lead fail and it could be a systole. So it's always important to take it seriously. If you're contacted by a teletech or you see an arrhythmia on the monitor, immediately assess your patient. This should be your first priority. I've had nurses that I've seen that have seen arrhythmias on the screen and been called by teletechnicians about an arrhythmia, and they immediately call the physician. I think the first priority should be assess your patient before calling. Telemetry technicians are able to print out a strip in relation to any arrhythmia. Even if it was 5 or 10 minutes ago or even 30, they can print this out. This is helpful in identifying the arrhythmia and making it available to the physician to visualize. So I had a patient recently that had maybe 2 instances of 3 to 5 second arrhythmias within 1 hour. I was on the phone with the physician and I was able to print the strip out, and I actually faxed it to the cardiologist, and this helped get our patient treated a lot quicker. Here are my references. Thank you so much for viewing my presentation. If you have any questions, please let me know, and thank you so much.